Genetic disorders. Most of the known genetic disorders are dominant gene-linked. However, the vast majority of dominant gene-linked disorders are not serious or debilitating. For example, the majority of those with Tourette's syndrome suffer only minor tics from time to time and can easily control their symptoms. When dominant gene-linked diseases are serious, they do not tend to become symptomatic until later in life. Huntington's disease is a dominant gene-linked disorder that affects the nervous system and is fatal, but does not appear until midlife. Recessive gene disorders, such as cystic fibrosis and sickle cell anemia, are less common, but may actually claim more lives because they are less likely to be detected, as people are unaware that they are carriers of the disease. Some genetic disorders are sex-linked. The defective gene is found on the X chromosome. Males have only one X chromosome, so are at a greater risk for sex-linked disorders due to a recessive gene, such as hemophilia, color blindness, and baldness. For females to be affected by recessive genetic defects, they need to inherit the recessive gene on both X chromosomes. But if the defective gene is dominant, females are equally at risk. Recessive disorders, homozygous. The individual inherits a gene change from both parents. If the gene is inherited from just one parent, the person is a carrier and does not have the condition. Sickle cell disease, a condition in which the red blood cells in the body are shaped like a sickle, like the letter C, and affect the ability of the blood to transport oxygen. Cases per birth, 1 in 500 births to black families, 1 in 36,000 births to Hispanic Latinx families. Cystic fibrosis, CF, a condition that affects breathing and digestion due to thick mucus building up in the body, especially the lungs and digestive system. In CF, the mucus is thicker than normal and sticky. Cases per birth, 1 in 3,500. Phenylketonuria, PKU, a metabolic disorder in which the individual cannot metabolize phenylalanine, an amino acid. Left untreated, intellectual deficits occur. PKU is easily detected and is treated with a special diet. Cases per birth, 1 in 10,000. Tay-Sachs disease, caused by an enzyme deficiency resulting in the accumulation of lipids in the nerve cells of the brain. This accumulation results in progressive damage to the cells and a decrease in cognitive and physical development. Death typically occurs by age 5. Cases per birth, 1 in 4,000. 1 in 30 Jewish Americans is a carrier. 1 in 20 French Canadians is a carrier. Albinism, when the individual lacks melanin and processes little to no pigment in the skin, hair, and eyes. Vision problems can occur. Cases per birth, fewer than 20,000 U.S. cases per year. Autosomal dominant disorders, heterozygous. In order to have the disorder, the individual only needs to inherit the gene change from one parent. Huntington's disease, a condition that affects the individual's nervous system. Nerve cells become damaged, causing various parts of the brain to deteriorate. The disease affects movement, behavior, and cognition. It is fatal and occurs at midlife. Cases per birth, 1 in 10,000. Tourette syndrome, a tic disorder which results in uncontrollable motor and vocal tics, as well as body jerking. Cases per birth, 1 in 250. Achondroplasia, the most common form of disproportionate short stature. The individual has abnormal bone growth resulting in short stature, disproportionately short arms and legs, short fingers, a large head, and specific facial features. Cases per birth, 1 in 15,000 to 40,000. Sex-linked disorders. When the X chromosome carries a mutated gene, the disorder is referred to as an X-linked disorder. Males are more affected than females because they possess only one X chromosome without an additional X chromosome to counter the harmful gene. Fragile X syndrome occurs when the body cannot make enough of a protein it needs for the brain to grow, and problems with learning and behavior can occur. Fragile X syndrome is caused from an abnormality in the X chromosome, which then breaks. If a female has a fragile X, her second X chromosome usually is healthy, but males with fragile X don't have a second healthy X chromosome. This is why symptoms of fragile X usually are more serious in males. Cases per birth: 1 in 4,000 males, 1 in 8,000 females. Hemophilia occurs when there are problems in blood clotting, causing both internal and external bleeding. Cases per birth: 1 in 10,000 males. Duchenne muscular dystrophy, a weakening of the muscles resulting in an inability to move, wasting away, and possible death. Cases per birth: 1 in 3,500 males. Chromosomal abnormalities. A chromosomal abnormality occurs when a child inherits too many or too few chromosomes. The most common cause of chromosomal abnormalities is the age of the mother. As the mother ages, the ovum is more likely to suffer abnormalities due to longer-term exposure to environmental factors. Consequently, some gametes do not divide evenly when they are forming. Therefore, some cells have more than 46 chromosomes. In fact, it is believed that close to half of all zygotes have an odd number of chromosomes. Most of these zygotes fail to develop and are spontaneously aborted by the mother's body. Autosomal chromosome disorders. The individual inherits too many or too few chromosomes. Down syndrome, trisomy 21, caused by an extra chromosome 21 and includes a combination of birth defects. Affected individuals have some degree of intellectual disability, characteristic facial features, often heart defects, and other health problems. The severity varies greatly among affected individuals. Trisomy 9, mosaicism, caused by having an extra chromosome 9 in some cells. The severity of effects relates to the proportion of cells with extra chromosomes. The effects include fetal growth restriction, resulting in low birth weight and multiple anomalies, including facial, cardiac, musculoskeletal, genital, kidney, and respiratory abnormalities. Trisomy 13, caused by an extra chromosome 13. Affected individuals have multiple birth defects and generally die in the first weeks or months of life. Trisomy 18, caused by an extra chromosome 18, and the affected individual also has multiple birth defects and early death. When the abnormality is on the 23rd pair, the result is a sex-linked chromosomal abnormality. This happens when a person has less than or more than 2 sex chromosomes. Turner syndrome, XO, caused when all or part of the X chromosomes is lost before or soon after conception due to a random event. The resulting zygote has an XO composition. Turner syndrome affects cognitive functioning and sexual maturation in girls. Infertility and short stature may be noted. Klinefelter syndrome, XXY, caused when an extra X chromosome is present in the cells of a male due to a random event. The Y chromosome stimulates the growth of male genitalia, but the additional X chromosome inhibits its development. The male can have some breast development, infertility, and low levels of testosterone. XYY syndrome, caused when an extra Y chromosome is present in the cells of a male. There are a few symptoms. They may include being taller than average, acne, and an increased risk of learning problems. The person is generally otherwise normal, including normal fertility. XXX syndrome, caused when an extra X chromosome is present in the cells of a female. It may result in being taller than average, learning difficulties, decreased muscle tone, seizures, and kidney problems.